Welcome to the second, I think this is the second talk of the winter 2022 term for the Sound Studies Institute. We're coming to you from Amisquatchie, Waskahegan, sometimes known as Edmonton, Alberta. We're in Treaty 6 territory, which is the traditional homeland of the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Inuit, and many other Indigenous people. And sound and music has been heard here and created and celebrated for thousands of years by many diverse First Nations and cultures. And tonight we want to add our sounds to this history and with respect and solidarity. So welcome. And if you're here for the first time, the Sound Studies Institute is a research institute at the University of Alberta that celebrates and supports research into sound, looking at sound from all angles, including performative and artistic understanding of sound, but also other ways of thinking and understanding about how sound works in our world. Tonight we're going to be looking at how sound can help us heal, which I think is a topic I'm really looking forward to hearing more about from our guest tonight. I want to say before I introduce our guest and the topic of this evening, some of you may have seen this in our previous announcement. I intended to get this into an earlier version of the announcement about tonight's talk. But if you happen to have a pair of headphones that you can plug in, especially over the ear style headphones, but really anything, even earbuds would be better than nothing. But if you happen to have something like that tonight, might be a good chance. This would be a good time to use them because we're going to be actually doing a little bit of an experiment tonight, which will be really fun. So I'll let Shaista explain this more to us in just a moment. But so I'm going to just read the description of this research. Hospitalization in the intensive care unit can have long-term psychological and physiological impact on people, affecting functional recovery and quality of life after ICU discharge. Post-traumatic stress symptoms, anxiety, depression, sleep disturbances, neurocognitive impairments, and intrusive memories are all common to ICU survivors. Anxiety affects approximately 70 to 80% of post-ICU patients. More than half of survivors report overwhelming mental health symptoms for several months after ICU. In COVID-19 patients, the psychological burden is even higher and persists for even longer. These greatly affect the quality of life of survivors and families, and of course, healthcare costs. Pharmacologic approaches have very limited effectiveness and can cause complications. Music and soundscape interventions are low-cost, patient-centered, non-invasive, and without dangerous side effects. Soundscapes consist of loop recordings, or can consist of loop recordings with distinctive sonic features, constituting a mix of natural, human, and musical sounds. Although soundscape interventions have been favorable, have very favorable effects in the ICU, less is known for the post-ICU phase. So this research is essentially intended to look at this question and look at some of these problems. And I find it really fascinating because I think when I've read about interest in understanding how music can help people heal or calm them or whatever it happens to be, it seems like a lot of times a lot of time is spent on the music side of things, sort of neglecting the other side of the soundscape of our world that we hear every day. And it reminds me of a moment I can remember from my childhood when I visited my grandparents in very hot Texas. And at night, here I am in the strange house, and I'm having trouble sleeping, and on kicks the air conditioner. And the air conditioner, of course, is this loud, spectrally dense noise, right? But for whatever reason, that particular sound in that particular place comforted me and helped me to sleep. So I find that really interesting. Just the fact that what kinds of things can affect us can surprise me, it can surprise us, and can go beyond what we would normally think of when we think about music. So Shaista Meghani is a PhD student in the Faculty of Nursing at the University of Alberta. She's a graduate teaching assistant and graduate research assistant fellowship in the Faculty of Science in computing science. And she's been working with Dr. Elizabeth Papathanasoglu, who's a professor and scientific director of rehabilitation and vision strategic clinical network, that's a mouthful, in the Alberta Health Services, and she's also in the Faculty of Nursing. She's also working with Michael Frischkopf, who is an ethnomusicologist in the music department as well on this project. And without further ado, I'm going to turn it over to Shaista to talk about this research with us and possibly have us try out some of these soundscapes. So thanks, Shaista.
Thank you very much, Scott. Hello, everyone, and a very good evening to you all. Thank you very much for joining. I welcome you all for today's presentation, and I would like to take this opportunity to thank Sound Studies Institute for inviting me to present our research proposal of a very interesting study. So let me share my presentation. All right. So tonight I'm going to present the research proposal entitled The Effects of Soundscape Listening Intervention in Reducing Stress and Pain in Healthy Individuals and Post-ICU Survivors. I'm Shaista Meghani. I'm from Pakistan, and I'm a nurse by profession. I have graduated from the Khan University School of Nursing and Midwifery, Pakistan. I have a rich clinical experience of working in critical care areas on different capacities and positions. And I currently am doing PhD in nursing from the University of Alberta, as Dr. Scott has already mentioned it. And my PhD research interest surrounds the effects of soundscape listening intervention to reduce stress and pain in post-ICU care survivors. And to lead this project, I'm working with my supervisor, Dr. Elizabeth Papathanasoglu, and Dr. Michael, who is also the faculty of University of Alberta. I would like to take the opportunity again to acknowledge these funding partners in supporting to our research project, which are Alberta Machine Intelligence Institute, New Frontiers in Research Fund, and VP Research Seed Grant. Before I move on, let me first discuss autonomous adaptive soundscape and the project goal. It is an intelligent bio-algorithmic system generating therapeutic soundscapes for critically ill patients, using machine learning and biofeedback to induce relaxation, improve sleep, reduce agitation, anxiety, delirium, and so on. So the AAS, which is autonomous adaptive soundscape, seeks to basically optimize the patient's sonic environment by dynamically selecting, tuning, and mixing files from an audio library encompassing a wide range of recordings like natural, musical, or synthetic. And our AAS reinforcement learning prototype can only select from around 1,000 soundscapes effectively. But our soundscape research team has assembled over 100. So that's important because people's preferences may vary widely depending on their background or whatever their conditions. So the issue is, for a given patient or any individual, how to pick the dozen soundscape that are most likely to work well when we can't necessarily get them to listen to them all. So our research contributes importantly to solving that problem. Once we have the results, we may be able to make an educated guess about the best pick of those sounds based on participants' demographic profile, which may include their medical profile or their musical taste and experiences, which we hand over to the AAS algorithm. Only then we can allow AAS to proceed to adjust the sonic environment dynamically in real time. So our piece of the research basically does not directly involve AI, but rather it's preparatory to developing the AI piece. Results of our research will allow us to design an effective autonomous system. So generally, one of the most vulnerable populations which suffers from stress, anxiety, pain, and post-traumatic events, sleep disturbances, neurocognitive impairments, and so on are critically ill patients, whether they are in the ICUs or any critical care areas or after the ICU phase. And treatments and experiences in the ICU are often stressful and can have long-term physiological and psychological impact that could affect functional recovery and quality of life. So we see that like pharmacological approaches are usual mode of treatment for such conditions, but can potentially cause harmful effects and are associated with increased cost. However, there are some non-pharmacological measures available, such as this, like sound and music therapies. These interventions are low cost, they are non-invasive and without dangerous side effects. The effect of sound and music therapy on the physiological and psychological variables of patient in the ICU has received some interest in, in the ICU. There are interventions available and being conducted in the ICUs as well. However, very less is known in regard to the effects of this sound or music intervention at the post-ICU level, when the patient gets discharged, when they go home, how they are going to self-manage themselves, how they are going to take care of their long-term, chronic issues and diseases. So multiple pharmacological interventions have failed to demonstrate improvements in preventing delirium or shortening its duration, leading to increasing interest in non-pharmacological therapies, such as early aggressive physical mobilization and sound therapies and so on. Research evidence has shown that music and soundscape can induce relaxation. It can improve sleep, reduce stress, anxiety, and delirium, so forth and so on. We believe that the study ultimately will be having significant potential to support better health for ICU survivors in Canada. And it is also pertinent for COVID-19 patients as well, who are recovering after the ICU, and they remain vulnerable to long-term effects which increase morbidity and heighten mortality risks. And most significantly, in relation to AAS can run continuously without need for personnel, even when this person is sleeping or doesn't want to or doesn't wish to intervene by picking a different soundscape. So no conscious active engagement with the system will be required from the patient when we are using AAS. So the objective of our first this research study is to discover the correlation between preferred soundscapes and participants and patients' characteristics. And also in the next level, we are going to explore the effectiveness of these soundscapes in reducing stress and pain and mitigating post-traumatic stress disorders for post-ICU patients. And this is the overall research objective of my PhD thesis, which is going to be conducted in 3 phases ultimately. And this pilot project is going to lead us to extend our research process further. So our overall research study will be based on quantitative and qualitative approaches, and it will be a participatory action research where different academic and clinical stakeholders and also study participants will be encouraged to serve in the research process. We are going to measure outcomes in the study, such as stress levels we are going to measure. We are going to measure their pain levels, and we are also going to measure their physiological parameter, which is heart rate. And we are also going to interview the participants to know their listening preferences and what are their experience after the intervention. which we are going to provide them. They will be asked to fill a demographic survey, which we are going to, we are going to do the same testing with you guys as well to see whether, is there any experiences that you felt, or how are you feeling with this testing, and what recommendation you could give us. So we are going to fill this, like the participants will be going to fill this demographic survey. They will measure their stress, pain levels, and their heart rate levels before and after each listening session, and their feedbacks and their experiences will be recorded. We will conduct the study on, this pilot study basically will be conducted in two groups, with the two groups. Like one group will be of healthy individuals. So we want to see that what are the experiences and the preferences of individual who is healthy. And the other group will be post-ICU survivors, and we are going to see that what are their preferences in terms of music, soundscape, and what are their experiences related to it. This will be our eligibility criteria to participate in this research study. And of course, the ethics approval of the study has already been obtained, and permission to recruit the participants have been approved as well. So what are we going to do in the intervention, and how implementation will be conducted? So we have collected some soundscapes from a music site, which is specifically designed for the purpose of this study. Participants will listen to the pre-selected soundscape for about like 10 to 15 minutes. And then they will rank the top 5 soundscapes which they feel most relaxing, and subsequently participants will select one soundscape from the top 5, and then they will listen to it for about 20 to 30 minutes twice per week for 5 days continuously. And then they will be asked to listen to their selected soundscape in a very calm environment at a time of their own choice, whether in the morning or in the evening. And then they are going to rate their stress level on the scale of 0, like means no stress, to 10 means worse stress, and their pain level from 0 means no pain to 10 means severe pain, before and after each listening session. And then all the outcomes which are discussed earlier, they will be measured. So these soundscapes can be played through any device, like for example, mobile phones or iPads or laptops or desktop computer, and they may adjust the volume of their preferred level. And each participant will be provided with the headphones when we are going to conduct the study on the actual study subjects. So our research team would like to, the time has come, and our research team would like to have a test with you all to see how do you feel about this intervention, and we would appreciate your comments and feedback regarding it, as this will help us in improving our research process, of course. And I would also like to request you all to have a headphone for that, because this will help you to, for the better sound quality, and it will help you to concentrate on the particular sound. So you will be hearing each sound for about 1 minute, and then you will be given a link of a survey where you have to you will be seeing like 12 soundscapes, and each soundscape you are going to listen for a minute, and you are going to choose 5 soundscapes that you like the most. Once you will do that, the second question will ask you the 5 soundscape that you chose, how do you rank them? So the 5 sounds you have to rank, like you like 7, you want to score it 7, or you want to score it 10 or whatever. So you will rank them, and then you are going to submit the form. Okay, so I'm just going to stop sharing.
Okay.
Yeah. And I asked, yeah, sorry.
No, you go ahead.
And I asked Tom to start this process.
For sure. So I'm going to share my screen and I'll play each of the sounds individually. And then I'm going to share in the chat the form.
I hope all the participants have understood the instructions. Do you have any questions? Should I repeat the instruction or is it clear?
Maybe if you let us see the form.
Yeah, sure.
That might answer some questions right off the bat.
Yeah.
So it's there, but I'll be playing the sounds for all of us as a group so that we can all stay together with that.
So just hit the link on the chat, and then you will see a form which has 12 soundscape, and you have to choose 5. And then in the next question, you have to rank those 5.
Yeah, and if I can clarify one thing for people, it looks to me like on the form, there's a little checkbox on the left, which I think is what you mean by clicking on, rather than clicking on the link, which takes you to the actual sound file. Don't click on the link because I think that Tom is going to play each individual file for us.
Exactly.
So he'll play all 12 sounds, and then we just click on the little checkbox, not on the link itself, right?
Yeah, thank you very much. Exactly.
Cool. All right. So I will start playing the first sound, I think, now. So sound number 1. Okay. So now I'll do sound number 2. And I just noticed in the chat, Lisa didn't hear anything. They're sort of quiet, so you may need to turn your volume up, or if you have headphones, that will help quite a bit. But so here's now sound number 2. Okay. And now this is sound number 3. Okay. And so now this is sound number 4. Okay. And this is sound number 5. And sound number 6. Sound 7. Sound 8. Sound 9. Sound 10. Sound 11. And sound 12. And that's it. So I'll put it over back to Shiesty.
Thank you very much, Tom. Thank you, everyone, for listening. I'll just quickly wrap up my presentation, and then I'm going to take your comments, feedback, and questions, and your experiences related to it. And I can see a couple of questions which are very interesting in the chat box, so we'll look into it as well. Just let me quickly wrap up the presentation, and then we can have your questions. All right, so whatever data we are going to gather, like the listening experiences and all those like stress levels and pain levels, we are going to analyze this data through quantitative data, and we'll analyze qualitative data with the statistics and the softwares. And so the conclusion is like the study is going to support the better health for ICU survivors in Canada and result in better quality of life for patients and their families. It will support the development of AAS, and which is an autonomous system whose value is that it can run continuously all day, all night without intervention during sleep as well. And it may produce a cost-effective, adaptive, patient-centered approach to stress reduction in this population. It may decrease in health service utilization and more efficient use of hospital resources, and can lead to restorative and preventive approaches to stress and anxiety after the ICU. And these are my references. Thank you very much. And my presentation is done. Tom will give you a link where you have to fill your the demographic survey, and this will help us to correlate your demographic, like means characteristic, with the your choices of the sounds that you just listen. So the floor is open for question and answers, and your feedbacks. They all will be very, appreciated, and it will help us in improving our process.
Thank you so much for that, Chaista. That was just fascinating. So I want to just jump right into questions, because if you're like me, you have a ton. I see one already from Carrie, who is asking, and this is a great question, I was wondering too, will there be some sort of volume adjustment? Because a few of them would have been more relaxing for me if they were at different volume, i.e. quieter. And I think this is just like maybe a way to expand on this question is maybe just what are your requirements in the proper laboratory environment, understanding that this is online and the Zoom audio isn't particularly great. So this isn't obviously the ideal environment. What is the ideal environment, and what kinds of controls do you give the patient in terms of adjustment to volume?
So basically the app, the Soundscape that we are going to give them is, it will be a very user-friendly app. And it is going to have the option of volume only, very simple, so that they don't have to play around and get confused with the complexity. So it will only have the volume, and they can adjust the volume accordingly, according to their own own interest, like whether they want high or whether they want low, or whatever their preferences will be. So and the environment, they could choose, like whether they want to listen it in the morning, they want to listen it in the evening, or in a room, or if they want to go outside and then they want to listen, they can. So basically it has to be an environment, a calm, a peace environment where they could sit and relax, or whether if they want to lie down, they can do that as well. So whatever time they want to listen to it, it will be their choice.
I see. So they have control over where they want to listen to this. Obviously, you give them some guidance about trying to find a location where they can feel relaxed. But
Yeah.
do you have any suggestions for them about background noise and whether they should try to find a quiet environment, or maybe it doesn't matter because maybe when it's mixed with the background noise, that's just part of it, depending on where they are, I guess. But what do you usually counsel?
Basically, we would definitely encourage them to have a calm, like without distraction environment, so that they could focus and concentrate and feel it. And that will definitely affect on whatever motive we are looking for, whether it is stress or anxiety and pain. And so obviously when they will listen in a calm environment, when they are relaxing, there is no distraction, and then they could feel it, and then this will help in some stimulants of the brain chemicals that would release and help them in reducing their anxieties and stress. Yeah. I hope I answered this question.
Yeah, no, I think that's a good answer. I mean, there's just a bunch of really great questions in the chat continuing here. So I want to let's see. How your study account for ordering bias in terms of the soundscape given? And this actually, I want to link this to another question down below. I'll get to your question too, Margaret, because it's a good one, but from Arlene about how it's difficult to recall so many sounds. Isn't there some study about like whenever you get more than seven things of any kind, like memory goes like this? But I found that to be the case too, and I realized this may not be the way you normally present it to people, but when you have presented it this way, do you find that that's a difficulty in just remembering? And because I remember, like for myself going through the exercise, I'm kind of like choosing the ones I like, and then when I had to rank them, and I was like, oh no, which one was that one again? Was that the one that was? So it's a little hard to remember them all.
Yeah, and I would also relate this with one of the questions in the chat. It says about if there is a title, a proper title, so that it helps us, to identify. So yes, this is a very valid point, very good question. And from the form perspective, in the Google form perspective, we were trying to have, title thing so that it's easy for the person to memorize and answer it, but it was difficult to do that. However, in the actual experimentation where we are using RedCap system and we are going to link those soundscape with the titles so that the person could identify what the sound is they are going to listen to it. In regards to the number of sounds, I'm not sure like how a person could recognize, remember. But we are thinking to give them at least 15 to 20 sounds, so that a variety of sounds, so that they could pick some from them, and then they have to choose only one. They don't have to go back and forth for every sound. No, they just have to pick only one, which is the best one, and that best one they are going to listen to the entire week. So this is the plan.
Okay, and they have a chance to sort of recalculate if they want. In other words, like if they chose a sound and they realize they wish they'd chosen a different sound, can they go backwards or?
Yeah, they could go backward, and they could choose the another one. Okay. Yes.
Great. And I'm just going to keep going here. These are great questions. Margaret is asking about. She says, several of them made me feel stressed. Soundscapes that are busy, or water it's running too fast, or stormy, heavy rain. I use soundscapes to fall asleep sometimes and avoid water and rain. I wonder if this is something that might come out in the study. And I was wondering about that too, just in terms of even the kind of risk assessment that you have to put into your ethics proposal, because I do know that, I mean, sound can be triggering for people, right? And it like what's like, and I use myself as an example because I have a pretty wide range of kinds of music that I like to listen to, and therefore I'm pretty, I don't know, the kinds of things that make me feel relaxed are probably not the kinds of things that would make most people.
Yes.
And in fact, some of them might actually be really disturbing for people. So I don't know if there's, if you think about like risk factors and those kinds of things when it comes to the sounds you're choosing.
Yeah, so it's a very, very good question. And this happens with me as well, because there are some sounds which makes you feel sad and you cry and, you know, things like that. So, and yes, in the ethics application, we answered this question that this is the possibility where some sounds may trigger their, you know, bad memories or something like that. So in that case, they could, you know, stop listening to those soundscapes. They could report to us. We will help them in, you know, whatever capacity we can, like in referral or whatever, and they can abort this sound intervention right away. And if they want to, you know, like they want to change to another sound, if they want our facilitation, if they want we to sit with them and select, we could also do that. So this is also a plan that where some of the participants are not, you know, friendly with the app or the play thing. So I'm, as a, you know, investigator or the research assistant we do have, so that person will sit with the participant and help them in, you know, figuring out everything. And once they are settled, then we are going to, then they can go, you know, individually at their own pace.
Sorry, I was muted there. There's some great comments in the chat as well,
Yeah.
that I'm not gonna read them all, but I just, there's some folks were some other comments about the number, but I think I see there's a difference between our little experiment tonight and the ultimate one that you have people working on. So I think that kind of answers that. And also just acknowledging that titles would be good. There's a question I wanted to ask that ties in a little bit to Sean Borrell's question about, are your sounds each individual static objects? Have you considered dynamic layering of different sounds? For example, the guchin over top of the water. And that I want to add on to that question. Also just wondering about whether you feel that it's necessary that the sounds, whether they're layered or whether they're individual sounds, whether the sound, do you feel it's important that the sounds be identifiable? In other words, what if it was, have you considered using sounds that are extremely abstract and perhaps don't point to any real world sounds, but could still nevertheless be relaxing? I don't know if that's a weird question, but it's one of the things that Sean's question makes me think about too.
To be very honest, I'm not very expert in sound thing. But obviously this is a good question, and I think Dr. Michael would be the best person to answer this question. Because honestly, I don't have any idea about like how the variety of the sounds and what is the layering thing. I have no idea about it, but Dr. Michael would be the best person. I wish if he could have attended this session, he could have answered. But definitely I'm going to share this question with him, and we can give the answer to you and you can share. Yeah. I'm sorry about that.
No, it's totally fine. And actually, I mean, part of it, I'm partly answering the question out of my curiosity, and I'm also just vamping off of what I'm seeing in the chat. I know because I've talked to Michael about this project, I know some of these answers already, but I'm still,
okay.
But I haven't talked to him recently about it because this project's been going on. Yeah. Okay. I'm just looking to see. Sean again says, it sounds like your target is post-ICU. Would it be possible to use these soundscapes during the ICU experience itself? Is it possible for sedated patients to benefit from this?
Yes, there are studies conducted already in the ICU, and we are actually, our team is divided into different phases of of this overall research. So there is a team who will work with the ICU patients in the ICU, and there is a team who will work post ICU patients. So for my project, like my piece is for the post ICU patients. However, in the literature and in the primary studies are available where the soundscape and music interventions are used in the ICU on the sedated patients with the mechanical ventilator patients as well. So yeah.
Now I wonder, in doing that though, and thinking about that, has there been any discussions about how such an intervention would work in the face of the already existing soundscapes in the hospital, which by their nature are somewhat stress producing, since they're not necessarily designed to make one comfortable or relaxed. They're more designed to alert the staff or to, they're sonification tools. And so it's interesting to think about the existing hospital soundscape and the idea that of what you're trying to do. I mean, do you block out the hospital soundscape and use headphones, or do you work with the hospital soundscape and redesign it?
Yeah, interesting. We could think about it, but basically what I have read from the literature is that in majority of the cases, they have used the noise cancelling headphones for the patients. And in terms of selection of music and sounds, some of them have used, like they have the music therapist already available. So the music therapists have the CDs of sounds. Some sounds are very culturally based sounds, like there are few studies in China, they have only used Chinese sounds, so they were doing the intervention with that. In some studies there are variety of sounds. In some they have just collected the mixture of every category, like country sound and things like that, and then they have categorize those sounds and presented to the patients. So yeah, variety of sounds, and with the music therapist or patient preferred or researcher preferred sounds are being used in the ICUs and critically ill patients. But for the post ICU patient, you would be surprised that I didn't find any single primary study for these patients.
Yeah, interesting.
So
Okay.
yeah, so this is interesting, that what happens when the patient goes home, then what?
Yeah.
Because most of the things, the triggers and the problems arise once they are home. In the hospital, there are lots of personnel, so they are well taken care of. It is controlled environment, but when they go home, they get confused what to do, what to start with. So yeah, so this is where we need to give some kind of relaxation or some kind of therapies along with physical or occupational therapists, so that they could cope up with the situation and can function.
So it does sound like having this kind of intervention being headphone based is probably pretty important, because if you want to try to duplicate the conditions that when you have control, you want to try to duplicate those conditions in the home as much as possible. And you can't really duplicate the hospital soundscape. So, but you can isolate, you can block things. I was noting someone's comment, Arlene's comment about consent when it comes to someone who's sedated. I find that interesting too, because I'm the kind of person I could imagine giving consent to do something like that, but then actually finding myself like in the situation where I wish it wasn't happening. You know what I mean? Because you just never know. You never know what kind of condition, what kind of mental state you're going to be in.
Yeah.
You put headphones on somebody and they're out, and you imagine that it might be helping them, and it actually might be torturous, right? Even if they've given, it must be really complicated to.
You are right. This would be a possibility, and yes, yeah, you're right.
I'm sorry, everyone. I'm doing a bad job keeping up with the chat. This is good though.
No worries.
Yeah, someone acknowledging about how the hospital soundscape can be quite stressful. By the
Mhm.
way, this question comes from some both Michael and I had been discussing this with a composer named Yoko Sen, who is somebody who's actually been working with hospitals to rethink this hospital soundscapes. She's a composer who's basically makes ambient music, and so that question comes somewhat from her, like, because she's the one who actually really noted this, and was recently, there was a really nice article about her and her work. So it's interesting to think about how composers could be involved in
Mhm.
creating these kinds of spaces, and also collaborating with the companies that make the devices that actually make sound in hospitals.
Okay.
So anyway, just another comment. Um,
Would you mind sharing that article that you're talking about?
yeah, I can do that. Yeah. I noted Lisa's comment about I wasn't especially pleased with the recordings with the constant horns blaring or disjointed rhythms. I would prefer a train on trainable, cat driving through the city at night or through the rain. Safe water sounds for me, horses walking cobblestone streets after the rainstorm. I loved that soundscape, but part of it was that, again, I'm an experimental composer, and I found myself listening to it, trying to understand whether those horns were actually horns, or whether that was some kind of an avant-garde performance of brass instruments out of tune, out on the water or something. I don't know. I just had, my brain went to a completely different place, but it's just, again, just illustrates how different people listen.
Yeah, exactly. So it depends on the preference levels, obviously, and we could see that how many sounds based on your ideas and based on your data, we will see how more sounds we could or add in it, and see what are the variety of sounds we have available.
Um, I'm just going to read this one out for Margaret. I'm somewhat familiar with studies exploring the positive impact of music when caring for elders with dementia. I wonder about exploring music vis-a-vis soundscape with dementia patients. Music with which they are or were familiar is very impactful, but this is not necessarily the same outcome as stress reduction for post-ICU patient, of course. But I myself think I might prefer music to most soundscapes. That's a great question, though, about people with dementia, because it's so interesting um, how little we understand about, like, the way in which memories and things fade. I remember when my great aunt became very bad with dementia, and she was a person who had always been a cat lover her whole life. She had, like, at one point in her life, just dozens of them living on her property. And so I remember my grandmother thinking, I wonder what would happen if I brought her a kitten. Would she lighten up? Would she remember something? Would it spark something? And it did absolutely nothing. So you just don't. But yeah, I mean, you wonder about how sound could work in that kind of environment.
Yeah.
Um,
Interesting. Yeah.
yeah, there's just continuing to be some good comments in the chat. I won't read them all out, but well, maybe we have time for what I'd like to do is see if there's any more questions. We could maybe take one more question before we end. Any last minute questions or comments from anyone? Okay, great. Well, thank you so much for this talk. I'm excited to see what comes of this project, and thanks for your willingness to share it with us in these early stages.
Thank you very much for giving me this opportunity, and I'm really glad for such beautiful, interesting questions and comments. And definitely, I'm going to discuss this, and we will work through it. And I would really request all of you to please fill those forms for us, so that it will help us to connect and see the correlation between the two. Thank you very much for joining, and have a very good night.
Okay, and for those of you, thanks everyone, and please feel free to give a little applause. And just so you know, our next talk will not be 2 weeks from now, but 3 weeks. We had to push the next talk back to February 16th. So Luthia Fritsky and Sabina Tharani will be here giving a talk entitled, "Who Said That? The Use and Appropriation of Black Voices on TikTok." I'm really looking forward to that talk. So that will be on February 16th. This is a brand new change. We will update the website soon. I think the website still has the old date, but so we'll see you in 3 weeks. And otherwise, have a wonderful evening and be safe.